You did everything right. You paid your premiums on time, submitted all the paperwork, and followed every single one of your doctor's orders. Then, a single letter arrives, and your world tilts on its axis. Your claim has been reviewed and denied. But who reviewed it? It wasn't a doctor. It wasn't even a person. It was a machine. Welcome to the new reality of healthcare, the health insurance denial machine, where artificial intelligence decides who gets help and who gets left behind. Across the United States, major health insurance companies are quietly handing over life-altering decisions to algorithms. These sophisticated systems can scan thousands of claims per hour, analyzing diagnosis codes, treatment costs, and patient histories. What once took a team of human reviewers days to complete now takes mere seconds. The companies call it efficiency. But for patients, it feels more like automation without accountability. Because when an AI model says no, it's not always clear why, and there's no one to ask. Every single claim you file, every doctor's visit, every prescription, every procedure becomes a data point. The AI systems learn from millions of historical claims, identifying patterns. If your treatment looks unusual, more expensive than the average, or simply doesn't fit the expected mold, the system flags it. Sometimes that flag triggers an automatic denial before a human ever lays eyes on it. The publicly stated goal is to streamline the process. The unspoken reality is cutting costs, and the result? Patients are left fighting bots instead of bureaucracy. This isn't just a hypothetical problem. In 2025, major U.S. insurers are reporting record-breaking profits, even as the number of claim approvals is dropping. That's not a coincidence. Every denied claim directly boosts the company's bottom line, and AI allows them to deny claims faster and on a massive scale. Internal audits have revealed that some systems are specifically designed to target cases that are less likely to be appealed: small-dollar claims, minor procedures, or claims from elderly patients who may not have the energy or resources to fight back. The automated denials fly under the radar, and the profits roll in. These aren't just statistics. They are real people's lives. Consider Maria from Ohio, whose son's essential physical therapy was denied by an algorithm that deemed it not medically necessary. It took 3 stressful appeals before a human reviewer finally intervened and approved the care. Or think about John, a cancer patient in Texas, whose life-saving treatment was flagged as experimental by the system. He lost precious weeks waiting for reapproval, weeks he simply didn't have. These aren't just unfortunate errors. They are the devastating side effects of a system built for automation without an ounce of empathy. So, how do these algorithms work? They aren't magic, they're math. They are trained on decades of historical insurance data, and much of that data is inherently biased or outdated. For example, if older patients had higher denial rates in the past, the algorithm learns to replicate that pattern, creating a cycle of denial. If a particular therapy was rarely approved 20 years ago, the AI learns to keep it that way. The code doesn't ask why. It doesn't consider medical advancements or individual circumstances. It simply optimizes for the lowest possible payout. Buried deep within the complex math are millions of micro-decisions that are actively shaping who gets care and who doesn't. You might be wondering, where are the regulators in all of this? The truth is, they're struggling to keep up. There is currently no national standard for how insurance companies must disclose their use of AI. This means most patients, like you, probably don't even know a computer decided their fate. In 2024, a Senate report warned that these automated denial systems operate in a black box with almost no transparency. But legislative action is slow, and technology moves at lightning speed. By the time lawmakers finally react, a new, more powerful generation of algorithms is already live and making decisions. When a claim is denied, you have the right to appeal. But the system is designed to make that difficult. Insurers know that the vast majority of people won't fight back. The appeal process requires gathering medical records, filling out complex forms, and having a huge amount of patience. Even then, your appeal might just be re-evaluated by the very same algorithm that denied it in the first place. In 2025, data showed that only a tiny fraction, about 2%, of all denied claims are formally appealed. While about half of those who do appeal eventually succeed, the overwhelming majority of initial denials stand, making the system incredibly efficient for the companies, but a nightmare for you. And these denial engines aren't just being built by the insurance companies themselves. A whole industry of tech firms has emerged, selling AI claims review software with slick marketing that promises to slash payout costs by up to 20%. Their brochures don't feature patience, they feature profit margins. They call it innovation. Doctors are calling it what it is: invisible rationing. Automation itself isn't inherently evil, but it's far from innocent. Somewhere between the quest for efficiency and the responsibility of ethical care, the system lost its heart. An AI may never get tired, but it also never cares. Until we demand transparency and accountability, millions will continue fighting decisions made by cold, impartial code instead of human compassion. Because in 2025, the new face of denial isn't a person stamping rejected. It's a silent machine, deciding your fate in less than a second. If this video opened your eyes to the hidden reality of AI in health insurance, make sure to subscribe. We're dedicated to exposing how technology is fundamentally changing our lives. Thanks for watching.